My name is Norma Norris, and I'm a prevention specialist and developer of the Reality Tour Drug Prevention Program. I know that as a parent, nothing is more precious to you than the health and well-being of your child. No matter what the age of your child, a primary concern for every parent should be drug prevention. Did you know the drugs of choice are changing, and the age of experimentation is getting younger and younger? At what age should you make drug prevention a priority? What about now? At this point, some parents are automatically tuning out this message, thinking it doesn't apply to my kid. My kid's a good kid and I trust him. I can't tell you how many times I've heard that from parents, or that my child is too young to learn about drugs and alcohol. Truth is, no matter how good your child is, their brain isn't going to be fully mature until age 25. It's not about trust. There will be some bad decisions made along the way. That's all part of growing up. If one of those bad decisions is to use drugs or alcohol, that can change everything, including all the hopes and dreams you've had for your child. Add this to the fact that the teen brain is wired for risky behavior, and you can see how trust has to be rooted in reality. With all that is known about the prevalence and consequences of substance abuse, what should you be telling your child? Every child will have to make their own decision about using drugs and alcohol, and they'll have to make that decision again and again. Will you continually provide the information they need to keep making good decisions? Just how much do you know about today's substance abuse issues? 48% of all students will use an illicit drug by the time they graduate high school. That's a lot of good kids. Marijuana is now the #1 drug of choice for teens, surpassing alcohol. It can be laced with other deadly drugs. And prescription drugs, particularly painkillers, they're the #2 drug of choice. And the average age to experiment with prescription drugs is age 13. Every day, 2,500 youth will abuse a prescription drug for the first time. Think about where you keep your prescription drugs. Are they where everyone has easy access, including kids and guests? By now you're thinking, but if my child was using drugs or alcohol, I would know right away and then I would do something. Fact is, on average, it takes parents 2 years to realize their child is abusing drugs or alcohol. Youth are becoming addicted while living with caring, loving parents who don't see the signs, maybe because they don't want to. There's not time enough here to talk about the other substances that are showing up in convenience stores and even in your flower garden. But it's not all doom and gloom. Right now, you have the opportunity to take prevention action. Our nonprofit has established several tools for families. Think of them like helpful apps for prevention. Here's what we know for sure is effective. Home drug testing, adopted as a family health measure, is just part of what you do to ensure the health and well-being of the family, and your child agrees to it. Start this as early as 10 to 12 years old, and it's more like a science experiment. By age 16 to 17, your child isn't going to ask you for the car keys and say, "Oh, by the way, I don't want to be drug tested anymore." Home drug testing is the best way out you can give your child. Peers will easily accept this reason not to party. Parents have told us they think home drug testing is a good idea, but they don't like to choose the time to test. So we have developed our Family Health Policy notification service. We randomly pick the time to test your child and send you a notice. You will get 1 notice during the year, but you may get 2 or 3. No one knows. Our Family Health Policy parent packets also include a 10-panel home drug test kit. Parent and child education is key, and Candle's Reality Tour Drug Prevention Parent-Child Experience will put you and your child on the same page after just 1 evening. Your children don't want to ruin their lives with drugs or alcohol, but there will be continually other voices telling them, "It's okay, it's not going to hurt you, it's fun." You need to be the constant voice for prevention. But what are you going to talk about? With what you know now about substance abuse, how long could you sustain a conversation? I promise that for years you and your child will talk about the Reality Tour experience. Thousands of parents have attended this evidence-based program and rate it as priceless. And finally, parents, you are still the most powerful prevention tool. It's not the school, and it's not your child's friends, it's you. It will be motivated parents like you and good kids like yours who can turn things around through prevention. It really is all up to you now. Learn where the nearest reality tour is located. Visit our website at realitytour.org and check out our national map. If you don't have a reality tour near you, our program model will get you started. You're just 90 days away from having a reality tour, a permanent drug prevention program. So please visit our website and sign up for one of our online presentations. Parents may order a parent packet online at realitytour.org. Schools or groups may inquire about ordering Family Health Policy parent packets in quantities of 50 or more at a discount. Packets include enrollment in the Family Health Policy Notification Service and a home drug test kit. I congratulate you for taking the time to consider this important message and for your desire to take action to protect our children, our families, our community.